right, so I look forward to sharing some useful tips on how to use AI for growth. And I'm going to share a lot of opportunities that you can use when it comes to healthcare and in your organization. So thanks for the introduction. I don't need to go over it again, but pretty much started my career at Google, where I introduced leading technology to large organizations on how they can use it for growth and productivity. So I look forward to sharing specific tips on how you can use it as well for your organization. So for some reason, whenever I post a picture on social media myself, I get about 20 likes. When I post a picture of my family, I get hundreds of likes. I don't get it. So this is them right here. So they say it's because she looks good, you're right. So, and this is my oldest son right here. So I live in Houston, Texas. So that's them. So 45% of doctors experience burnout. Would anybody agree with this? 45%. So one of the areas we're going to talk about today is how to use this technology to prevent burnout, and not only thinking about it from a standpoint of efficiency, but how can AI help the entire organization and the different departments that's in it as well. So what is AI? So pretty much everybody here is pretty much using AI. How many people here are using AI in their personal life? All right, so pretty much everybody. How many people are using it within their organization? All right, most people as well. All right, perfect. So it has the ability for machines to learn, reason, and act in ways that mimic human intelligence. And of course, traditionally follows a set of specific pre-programmed instructions to solve a problem. It can only do what's expected to do. That's how it was for a traditional computer program. But now, of course, with AI, we remember that everything's always inputted in, it's constantly learning. It's constantly getting better as time goes on. So results, so when it comes to the results, one thing we like to do when we talk with organizations about AI and we do some training, we ask to do a survey, and we survey the employees that are within the organization. And so one of the questions was, do you use AI outside of work? Mostly said yes. How would you describe your AI skill? Nobody wants to say they're a beginner, right? So most people say they're intermediate. Some people say they're a beginner and advanced. And which best describes your feelings about AI? So excited, eager to learn, and figuring out how to use it within their workplace. That's what most people say. So throughout this presentation, I'm going to go over some of those results from the research, and also just go over how can you benefit from it as well. So where AI started, so in the 50s, a group decided to figure out, well, what can a computer do that mimics human thinking, right? What can it do? And so they spent time and they came up with some great ideas, and eventually they got funded by the government. And what happens whenever you're getting investments is, if it's not paying off, you're not getting a return on investment, what happens? The investments stop. So that's what happened in the 80s. All right, so investors' enthusiasm waned in 90s, right? And now, closer to where we are right now, in the 2000s, machine learning was applied to a wide range of problems in the academia and industries. And deep learning came out, and that was where the breakthrough happened. And now we have where you have ChatGPT with large language models as well. So of course, everybody's investing in it right now. So where we are right now, so you're pretty much using it in their day-to-day life before ChatGPT. So you have Siri, you have facial recognition, you have Google Translate, YouTube recommendations. So we're pretty much using it frequently in different areas. And not only when it comes to the tools we use, but even the videos recognition that's happening as well. So when I say video, when it comes to AI, it's not just about recording video, it's more so the video recording, but it's in real time analyzing what it's seeing and what is comparing it with what's happened in the past. And then when it comes to AI, you're going to have two different words that you're going to see often is predictive and real time. So what can it predict in the future, and what can it give us in real time as well? So another question is, have you used AI tools, ChatGPT, Copilot before? Of course, people said yes. And then we asked them, what tools did they use? So this is an important question, but it's great that everybody's using the tools, but the challenge is most people are only using like one tool. So ChatGPT, nobody's really using Gemini, and that's great that they're using it, but the challenge is, how do they make sure that the information that they're getting is accurate? How do they make sure that what they're getting is quality content that they can use? So it's always good to use multiple tools, not only to check what you're getting is correct, but also have better content that you're trying to get. So when it comes to the tools, there's two different types. You have the general tools right here. So of course you have the ChatGPT, you have the Claude, Perplexity, Copilot, and most of them help you with general productivity. Claude right there is really good for like long form content, white papers. Copilot is really good in healthcare as far as emails and writing. And then Gemini is good for research. So it actually tells you exactly how the machines are learning, how they're thinking, and what are they doing to get to the answer that they're getting to. So you have the general type of tools, and then you have the specific tools. So let's say you want to help with your marketing department. Jasper is a really good tool to write content. And even when it comes to voice, you have tools that can help you create voices. So check this out.
Like this, a middle-aged American with a soft, high voice, conversational, quick, and cheerful. Then you can auto-generate the text, or you can type in your own text if you want that. So now it has adjusted the text based on my prompt, and now I can generate these voices. For the settings, I usually just keep them at default. So for the settings, you can change around the loudness, quality, and the guidance scale. Usually, Labs already does a pretty good job at it, but if you have something specific in mind, you can tweak it right here. So now let's have a listen to these voices.
Oh, hi there. How's your day going? I just picked up a new book.
Oh, hi there. How's your day going? I just picked up a new book from...
Oh, hi there. How's your day going? I just picked up a new
All right.
book from the...
Can you might name what they can do with a tool like this, as far as voice? Anybody?
I can fix my overhead announcements in the hospital.
Okay, all right, overhead announcements. Okay, record the overhead announcements. And let's say maybe you're doing training for the staff and you need a voice to do that. You just write in the prompt and it can create the voice depending on what you say as well, right? And then, so you have these tools, and then you have this tool specific for the task that you're trying to accomplish. So AI for productivity. So that's one of the main things people use it for right now within organizations. So productivity, I was in this program called Goldman Sachs 10,000 Small Business Program. And within this program, every week on Friday, we would get together and a speaker would come and present content about different aspects of business, leadership, sales, and other areas. And so they would break us out into groups and have us answer questions from a case study. And this case study was about how can we help a person in the company reach their goals better, their sales goals. And they gave us 10 minutes to go over this case study, and for some reason within 30 seconds a table mate was able to get the answer, and we were shocked at how she was able to get the answer so quickly. And it turns out that all she did was took a picture and put it in ChatGPT, right? And so it was shocking, and then that's kind of helped us realize like, wow, this is really advanced and this can really help productivity, not just typing stuff in, but taking pictures and turning that into content. And of course the information that it gave us was good, but again, you always want to check this with other tools that you're using as well. Now, when it comes to AI, people think only efficiency, but we got to think about how can we help our entire organization? How can we help when it comes to employee experience? If we think of it that way, we can have higher employee morale and better retention as well. So how can we help them with their scheduling? How can we help, how AI can help you with the training of the staff or even hiring as well? So for example, some of these tools were already out before as far as these surveys that can help you figure out, well, what is the sentiment with your employees? How do they feel? Are they stressed? Are they burnt out? But now with AI, what you're gonna realize is it's more personalized based off the person that that's giving that review. So a lot of recommendations, whether that be training, whether that be staffing, it's based off of their personal experience with that company. So I definitely encourage you to implement any type of survey that can help you understand the morale of the company. So AI for documents. So quick question, what do you use AI for right now? Everybody raised their hand earlier that said they use AI. So how do you, yes, back there.
I literally just used it to write a prayer for my dad's celebration of life.
Oh, okay, wow, great, definitely. All right.
I use it to set tone in emails.
Okay, set tone in emails, okay.
Help me with my tone.
Help you with your tone, yeah, there we go.
I use it to summarize minutes from meetings.
Okay, summarize minutes, got it. Anybody else? Yes.
Learning objectives for a presentation and also like summarizing presentation content.
Yeah, okay, summarize previous sketch content, okay. Yes, over here.
Brainstorming community events.
Okay, brainstorming community events, got it. All right, that's great. Anybody? Yes.
For hours per patient day.
Say it, please.
Calculating like hours per patient day.
Oh, okay, calculate hours per patient day. Okay, anybody else? Yes.
Root cause analysis.
Root cause analysis, got it. All right, so great ideas here. And I should have put that video on in this presentation, but there was a video online where a lady was doing a sermon and she was reading it from ChatGPT, and she read the last portion where it says, "Feel free to edit this to your needs." Yeah, so you definitely want to review this and be careful what you're reading, right? So, and people were trying not to laugh, but some people were laughing in that audience. So I'll put that in the next presentation. All right, so when it comes to the tools that you choose, think about the tools that you're already using within the organization. So how many people here use Google for their emails? Okay, Google. Anybody Microsoft? Okay, mostly Microsoft. So Google has Gemini, so that's their tool. And I'm a Google person. I use Google, and I use Google Docs and Google Drive. So when I use Gemini and I throw in a Google Sheet that has 3 different tabs, it's going to give me a really good summary about what's in that tool. So what tool you're using right now, see if they have AI already available, because that's much easier if you're already using that tool. So same thing, if you're using Microsoft, Copilot might be the one that you use because it's already integrated into Outlook, email, and the other documents that you're using. And it can easily summarize the content. So Gemini, so one of the good things about Gemini is it again shows you what it's doing to get to the answer, and assists clinicians with evidence-based answers by pulling large data sets. So if I'm looking for information on treatment, you put the information in there as far as the question, and it's going to literally tell you that we reviewed over 103 websites that helped us come up with these answers. Right? So again, and this is still like a general tool. It's not a specific tool to healthcare. But a tool that's similar, that's specific to healthcare, is Open Evidence. So they said if you were to, let's say you're any type of doctor and you wanted to look at peer-reviewed articles that are recent, every day, it'll take you about 9 hours to figure out the most recent information about what's going on in your specialty, in your field. So what this tool does, it works like Google, and you ask the questions and it kind of summarizes what's going on in your field. So specifically for healthcare, so Open Evidence. So a really good tool. Many hospitals are starting to use it. So again, you have the general tools and you have the specific tools for your needs. So I would recommend writing down all your processes in different areas of your organization. If you write down your processes and you figure out, well, what can AI do and what AI can't do, that'll help. And also, not just going to the general tools, but thinking about, well, maybe there's a tool out there that helps you for that specific challenge that you're facing. All right. So AI to be concise, some people said it already. So let's say we want to talk to vendors, we talk to teammates, doctors, executives. We want to get our point across a little bit easier, right? We want to make sure that we're concise in what we're saying. So the words we use matter. So for example, the word need, you can use the word important instead. The word should, imperative. We use the word must. When you hear the word you must do something, what comes to mind?
Demand.
All right, demand, okay. All right, so maybe you could use necessary instead. So before we had to go to Google and type in, well, what's a list of power words in order to make my message better? But now, of course, you can throw in these words specifically into like a Gemini, and it'll let us know, well, why is it important to use some of these words over the other words? So of course, making your message a little bit more clear and more specific. And for example, when do you check your emails? Any ideas? When do you check your emails? Is it as it happens? Every hour? Don't want to say? All right. I had a person that I used to work with, he read a book, and the author of the book said that he only checks emails on Fridays, once a week. Right? So my coworker decided to do the same thing at our job. And so whenever we would email them, we will get a response that says, hey, greetings, esteemed colleagues, I'm only checking emails on Fridays. If you need something urgent, give me a call. So what do you think happened? A lot of calls?
Lots of calls.
Lots of calls. We don't know what happened to him, but he stopped doing that within 24 hours, right? So it turns out that the author was retired, so he can check emails once a week, right? So But anyways, when it comes to emails, you want to think about making it more concise. So I put this into one of the AI tools. So this is just an example of talking with a doctor trying to get documents. And so just think about all the time we spend reading emails. We already have to use data. We already have to input data. We have to find data, right? So people are already busy. So you want to make sure your messages are concise. And not only that, but the team messages are concise too. That's why you come to this presentation, but you want to make sure you help everybody else in the organization implement. Because there's no point if you're really good at email using AI, but other people are not. So of course you could throw this in and make it only 2 sentences, right? So getting to the point, using bullet points. Anybody go to too many meetings? Anybody had a meeting today already? Oh, really? All right. So let's watch this video and then we're gonna talk about how AI can help with meetings.
Trip Crosby
has joined the meeting.
Beth?
Has joined the meeting.
Hello?
Tyler?
No, this is Beth from ICS.
Oh, hey Beth. How are you doing?
Oh, good, yeah.
Tyler?
Has joined the meeting.
All right, well, this is Trip. Who's here? Tyler's here.
Beth's here.
Okay, the purpose of today's meeting is to discuss the...
Yeah, I'll be able to do it in 30 minutes. John?
Has joined the meeting.
John, I was trying to go over the purpose of today's meeting, which is to discuss the deliverable. Tyler?
Has joined the meeting.
Sorry, guys, got cut off.
Is Paul here?
Put in your access code.
No, that's your PIN number.
It should be a 9-digit number.
Try pressing the pound key.
Paul,
Has joined the meeting.
any questions before we move on?
Yes, this is Beth. What's our best plan of attack for the second quarter?
Question actually... Oh, go ahead.
Oh, I think
Well, it actually depends on how you look at it, because the really Go ahead.
Given sales, we're at
Let me just say that. Great graph, John. Tyler?
Well, my main concern with Cheer was
John, are you guys taking distributions? John?
Oh, my bad. I was on mute.
So I prepared a presentation. I'm sharing it with all of you. You see it on your screen right now.
Got it.
I don't see it. It says I need to download it. I thought
We are all using Macs, I'm assuming. Right? Great. Paul, do you have any comments on staffing? I was Rex, get down. To me, staffing is a huge. I just want to go over a couple of details as we move into our next section here. We got 3 new departments coming on.
break it up a little bit, guys.
Detailed evaluations.
Sorry, guys.
That's it, guys. Beth, you'll send out a recap email. Good. Basically taking the place of this whole meeting, correct?
Yep, always do.
Thanks for doing that. Hey, been here the whole time?
All right, anybody been in a meeting like that? All right, anybody been in a meeting like that today, yesterday, this week? Right, still happening, right? So just think about all the time that's wasted when it comes to meetings, right? So you want to use AI to help with the productivity, not just in your organization, but in meetings. So this tool right here will help because it helps pretty much be a note taker. So the note takers in the meetings, they're doing a great job, but they can't participate in the meeting often. And you have to follow up people that didn't make the meeting. You have to have a phone call with them. So all that takes a whole bunch of time. So this one it logs on with you. It's a chatbot, logs on, and it records the meeting, and also it summarizes the meeting afterwards and can send an email to everyone and create blog posts about that meeting as well. So many different opportunities you can seek. And this is just one of the many tools that can help you do that. Again, more productivity for everyone. So AI materials and content. So we're always creating content. What kind of content do you create? Any ideas? What kind of content? It could be anything. Images, videos, text, documents. Sign-in sheets, okay, sign-in sheets. All right. So whatever we do, we're always creating some type of content. Maybe it's white papers, or maybe it's content for the doctors or people that are in the hospital or the healthcare facility. But we can use AI to help us create it a little bit faster. So tools like this can help you when it comes to easily editing video. So if I were to record this presentation and I wanted to create a training for team members, all I gotta do is upload it, and it will automatically view what areas of the video should be cut out and what should be stay there, and also put captions automatically and size it to the right platform that you're trying to reach. So useful tools. And also think about how can you create fast content. Let's say you have an event coming up for your organization and you want to create a quick video for your marketing team to post. So you can figure out, go to your website and take pictures down and create videos from it. So this is from the IHA website. Anybody recognize the picture? IHA? People that were at IHA? Yeah, it's on the homepage of the IHA. But it's a picture there. I was like, you know what, let me turn this into a video. So all I did was throw it in one of the tools, and it turns it into a video, right? So this is specifically a picture from the website. So it's created and it automatically made it. I think this was about 10 seconds that it took to create. And I'm gonna send out a list of you, scan QR later, for all the different tools that I'm mentioning as well today. So let's say, for instance, I want to, we have a truck. I have a business that's delivering materials, and I wanted to create a quick video. So, you know, all I said was, make this truck blue, and it does it, all right? But what else do you think should go on this truck? Any idea? Logo? All right, got it. All right, logo. So logo, I said, okay, put a logo on this truck. All right, so what else can we do with this truck? Any idea? Change its color. Change the color. And I said, you know what, let's make it go a little bit dry, right? So again, this only took me about 10 seconds to create. So think about all the different content you can create for your organization fast if you don't have a videographer available quickly. So now, whenever we're reaching out to people in our organization, vendors outside, we need to reach them effectively. We want to write effective emails with AI. We want to connect with them faster. And a question that we often get is, when do you want to reach people? When do you want to reach people as far as when should you email them? When should you post things online to reach your audience that you're trying to reach? So here are the best times to post when it comes to social media, right? So we have LinkedIn 7 to 9, Tuesday through Thursday, Facebook 1 to 4, Instagram midnight, Pinterest 2 to 4 p.m. Thursday, they said Thursday is the best time to post on LinkedIn. My opinion is by Thursday, everybody's fed up with their job and they're on LinkedIn looking for other jobs. But that's just my personal opinion. That's my personal opinion. So I don't know if it's true or not, but yeah. But this doesn't matter anymore. Because we have AI, we don't need to do any guessing. We don't want any generalizations of what to do, what to post, when to contact people by email, when to call them. All the information is there specifically to our industry. So this is like specific, see when, if you're in healthcare, when you should post, what type of content you should post. And not only that, but it really takes into consideration who's in your audience. So these type of people within healthcare are available at this time. These type of people are doing this during the hours of lunchtime. This is the best time to send an email to them or sales email. So you really want to make sure everything's more geared to your audience these days, instead of generalization and instead of any guesswork when it comes to reaching out to people that you're trying to connect with. Right? So personalized outreach messages and published reports generated with analysis of industry trends. So the word that I mentioned earlier when it comes to AI is predictive. So predictive in real time. So what would you like to predict? It is?
Turnover.
Turnover, okay, turnover. What would you like to predict?
Lottery numbers.
Lottery numbers. Lottery numbers, all right.
Sporting event winners.
Sporting event winners. This is a healthcare conference though. What's going on? It's like, all right. Huh? Denials, okay, denials, okay. Anybody over here?
Discharge planning.
Discharge planning, okay, discharge planning. Yeah. Anybody else? Within healthcare, what would you like to predict?
Readmissions.
Readmission, okay, readmissions. All right, got it. So most of what's mentioned, except for the lottery numbers, can be predicted, right? So within healthcare. So predictive. So let's take, for instance, of preventive maintenance. So before we have preventive maintenance, so the machines that we have in the hospitals, in the healthcare organization, we have preventive maintenance, follows fixed maintenance intervals regardless of condition. So maybe every 6 months you check in on these machinery. Every year you check in on the machines or you switch them out, no matter what's happening to them, no matter what the quality. Conditional monitors and schedules maintenance when specific conditions are met. So let's say one thing is broken on the machine, then we make sure it's fixed. Then we have reactive maintenance. Of course, if something breaks down out of nowhere, we have to immediately fix it. But just think about how much time and money we're losing when we wait till this area happens. Right? So I took my wife's car to the shop, and driving home, it was about 30 minutes in after I got an oil change and everything, and the car just stopped on the road randomly. And I tried to just press the pedal down. It wasn't working. Tried it like 5 times, tried to get it started. And so I finally told it to the mechanic, and he said that, well, the fact that you tried to start it a couple times, that cost you $500. So once it stopped, you should have just brought it to, the mechanic. And I thought, like, how much money we waste by doing things like that. So reactive maintenance. Now we have predictive maintenance. Use real-time data and analytics to predict equipment failures. So you can implement tools like that within your organization, so you can save some time, save some money within your hospital. Right? So Change Healthcare, part of OCM, so they pretty much make some great products. So faster diagnosis, it hasn't really, as far as like all types of diagnosis, it's not really advanced yet, but they're working on it. So trained on large medical data sets, analyzing images to detect patterns. All right, so that's one thing that a lot of these tools are looking for. But again, what I'm going to mention too is you want to, before you decide on these tools that you get, I would say figure out what do you need if you're a manager, what does your team really need? Because you don't want to just implement a lot of these tools and then nobody uses it and then it's a waste, right? So you want to really survey what is needed, and remember, write down all your processes so you figure out what to choose when you need it, all right? So some of these tools like Viz AI, it helps when it comes to team notification. So patient does scans and faster team notification for the team that's responsible, and of course door to intervention, right? So this is good because if we can predict how many people are going to be in the hospital, how long they're going to stay, again, that can help us see more patients as well. So Viz AI. So another area is personalization that I mentioned. Personalization is crucial when it comes to figuring out how can AI help us in the long run. So one tool right here, it helps you with predicting the turnover. So somebody mentioned earlier, how do we know how long people are going to stay in our company? How long, is it 3 months, is it a year, is it 6 months? All right, so the performance and engagement. And again, this was already done before, but now it's personalized based off the employees. So for example, there's always been tools that help you be a better leader, a better HR person if you're in HR. But now these tools are helping you have better conversations with your team members. Let's say you just got promoted to a manager and now you have to do one-on-ones with employees, and you really don't have experience with that. These tools will help you to guide the conversation based off of the employee's work performance in the past. Anybody use AI to hire? Hiring process, all right? Find employees. So that's the way. So Epic Systems provides predictive analytics for patients' outcomes, readmission risk, and personalized care. So many hospitals already use Epic. So again, this is an example of a tool that you're already using. They may have a tool with AI that is connected with AI. So anybody working auditing? Compliance, all right. Is it a hassle? Is it a nightmare?
Everyone's favorite thing. Everyone's favorite.
Everyone's favorite. Okay, everyone's favorite. Anybody else? Auditing. So my mother-in-law, she works at the hospital, and she's every time the auditing comes around, that's like the worst. It takes a long time. So there's even tools to help with that. So the compliance is a challenge, right? So some of these systems, this tool right here, so monitoring, so AI system can automatically scan updates to make sure the hospital is compliant. And audit preparation. So again, one of the major issues is the burnout. So burnout is a problem, and making sure that people at least can save time and they can do what they love best in their job. So AI-powered dashboards can organize records and detect gaps in documentation before the audits. So documentation and compliance. So even whenever doctors are putting in information into these systems, if they're burnt out, well, let me ask you this. If employees are burnt out, what does that cause? What happens? What happens if employees are burnt out? What can happen?
Causes turnover.
Turnover?
Poor quality.
Poor quality, yeah. Poor quality?
Toxic workforce.
Yeah, toxic workforce. And also, they can make mistakes, right? So that's one of the challenges. If there's too many people burned out, then they could possibly make mistakes. And some of the tools that I'm presenting, it can help just pretty much monitor any type of mistakes that are happening. So that's another way you can use AI. All right, fraud and waste. Anybody deal with fraud here within the compliance, right? So fraud and waste, unusual billing patterns. That's another area. So when it comes to employee experience, we talked about productivity, we talked about content. Now let's talk a little bit about the employee experience. So predictive staffing. So HCA, what they're doing is they pretty much use AI to forecast. So forecast staffing levels when there's more people in the hospital, more patients as well. So again, that helps with employee experience. That helps with their organization, saves time, saves money, and people are not on the clock when they don't need to be on the clock as well. So predictive staff, so you can look this up. So anybody currently use text-to-speech or speech-to-text? Yes, how do you use it?
Most of the time it's to use it for text messaging, but I actually use it more so with just speaking out to ChatGPT. Please write an email expressing the following items, and then it spits it back out to me without pauses and ums.
Okay, got it. All right. Anyone else? Speech to text. So within hospitals, one thing that's happening is you can use it to where if a patient is talking with a doctor, it can automatically be recorded, so voice to text, and it can automatically create notes for the doctor as well. And it can summarize what's happening. So workload balancing and telescheduling tools can help prevent burnout as well. So again, so text speech, this is major. This is probably one of the first things people are using when it comes to like doctors. So I talked to many doctors that are actually using it. So it saves them time, saves time with the paperwork as well. And here, Northern Health, what they're doing is they're using chatbots. Anybody use chatbots here? Chatbots? So there's so many different ways you can use this. One is onboarding. So new hires, they can interact with chatbots if they're looking for policies, if they're looking for information about their current job. Or they're also using it to where patients can look up information and chat with chatbot about what's going on. So again, this saves a lot of time when it comes to the people that are usually answering these questions. So policies, scheduling, and implementing. So again, highly recommend this type. And help desks, I'm pretty sure everybody has a help desk department, right? That can help with IT. All right, so think about all the time that they're using and spending on passwords, resetting passwords, people lost their computer. So you can use AI to help you in that area too. Maybe you're short in staff and you can have these chatbots help people create answers. And I've seen a lot of different companies, like one of our clients, as far as hosting their website, now used to have to call in to get updates on your password. Now all you can do is use a chatbot, and within, I'll say, 2 minutes, passwords change and people will have access to their accounts as well. Right. So the process is important because whether it's a small task or a large task, it'll help you to understand where you want to go when it comes to choosing the tools that you have. So let's watch this quick video about one type of process. So I just mentioned earlier how you can do the conversation, you can create notes from conversations using voice, but let's look at more of what you can do.
New levels of customization, from ambient note creation and natural language dictation to custom texts, templates, and AI prompts. Copilot gives you control over how documentation gets done. It also lets you surface information without leaving your workflow, from querying notes and getting medical information to receiving encounter recording suggestions. Copilot gives you access to pertinent information when you need it most. And with an integration to Microsoft Fabric, healthcare organizations can unlock insights at scale by tapping into point-of-care data. Beyond that, it lets you automate tasks with a single click, from summarizing evidence to prepping orders, drafting referral letters, and after-visit summaries. Copilot saves time. Dragon Copilot takes clinical productivity to new heights.
So
you can do more.
I just wanted to show that because it's not showing you, well, I'm not recommending any of these tools. I'm just showing you so you can understand what's possible. So what is possible when it comes to AI? So we just talked about how, well, you can do voice to text and vice versa, but think about the entire process. You have talking to the patient, you have scheduling the medicine, right? You have inputting documents. So maybe there's like 10 steps. Think about how AI can help you with each of those steps versus just one of those steps. So now let's talk about an important area when it comes to, in general, AI. Everybody's searching, so AI for search. So this could be searching internally for documents, and this can be searching externally online. So here are the top search engines. So we have Google, Bing, and Yahoo. So Google is the largest as far as that brings up sites. Can anybody name the last two that bring up websites? It starts with A. Whoever gets it right gets a free trip to Houston, Texas. Not getting a free trip to Houston, but yeah. Oh yeah, you got it. Okay, ask. Okay, and there's one more that starts with A. AOL, wow. Give them a hand for that. So that was quick. Anybody still have an AOL email address? Don't be ashamed. Anybody? So somebody's ashamed. I'm pretty sure there's always one person that has an AOL email address. All right, so these are the top search engines: Google, Bing, Yahoo, and Ask, and AOL. But now everything has changed because it's more people using AI to search. So it used to be, well, you're desperate when you go to the second page of Google. Now it's you have to be top 5 of Google, because when people are searching these AI search platforms, then they're recommending the top 10 that's already on Google, Yahoo, or Bing, or sometimes, unfortunately, they give you the top 5. Unfortunately for businesses, they give you the top 5. So it's getting to the point where you have to be the top 5 of traditional search engines in order to really be effective on the AI platforms as well. So I did a search on ChatGPT, and I said I'm looking for nursing jobs in Texas. So it gave me a list right here. So how many is this? 5, right? So this is a list of 5. Hospital system, location, and it gives me notes and a link to the hospital. So what does this mean for us? This means that if we're not top 5, like I said, then we're missing out. So if you're posting jobs out there, you're trying to get candidates, and this is one of the ways you want to do it, because these jobs might be posted specifically on their website. This might not even be on Indeed. It might just be on their website. So it's pulling from that data. So if you're not on this list, you got to figure out, okay, well, what are they doing that's different from what we're doing? Maybe their website is formatted differently. Maybe the layout is different. Maybe they have more information on their job description. So this isn't really the most important part whenever I search ChatGPT. The most important part is the follow-up questions that ChatGPT asks the searcher. So now it says, if you tell me which city or county you prefer or what type of nursing you want, I can pull up a list of jobs in your preferred area, plus help you target the ones most likely to hire. So of course, most people that are looking at this, they're gonna say yes. And that's when it even gets more detailed. So you wanna answer these questions and see what ChatGPT pulls up for your type of industry, your type of organization, and see if your content pulls up. If not, you need to go to your website and check out what are you doing that can be changed that's more similar to the people that are coming up. And something that's cool is you can even ask ChatGPT why you listed those websites you listed. And it'll give you the answer on why they're listed. Sometimes they say, okay, well, do you want me to put your brand on the top of the list? You know, so they even do that as well. But in general, you want to be mindful of that. This one, I said, I'm looking for top San Antonio hospitals for surgery. Again, same thing, list of about 5. And a lot of times what we're seeing right now is they give you different options based on what you're searching. So they'll say, well, this one's good for this type of surgery. This is good for if you're in a rush. This is for good if you're in this neighborhood. And then it even gives you advice, tips to check and ask before choosing. All right, type of surgery, patient safety and outcomes. So again, if you see this, you need to have these answers on your website. That's why FAQs are so important. So they're not just for the patients, but it's for search engines. So if you have FAQs on your website, Google's gonna pull it, ChatGPT's gonna pull it, and it's gonna help them recommend your brand online. And so voice search is an area, it's not highly used right now, but I see it in the future being used more often. But when it comes to voice, think about what are people talking like versus what are they typing in. So we speak differently than we type, right? So have that in mind when it comes to the content on your website and other areas where you have content. And we've already heard people saying that, well, they do have, they're starting to use voice to talk to ChatGPT. Anybody use ChatGPT or other searches, AI searches to look for products and services? Okay, what type of products? Anything?
I looked for heel cushions yesterday for my uncomfortable shoes.
Oh, okay, wow. All right.
That wasn't health related.
Yep, okay, for sure. So again, yeah, so a good way. And now Google even has a new product that they released 2 weeks ago, where if you're looking for a certain service, it can literally call the businesses for you and ask for prices and get you a list. It'll email you a list of prices in the area after they give a call to the businesses. So all you gotta do is type in look for prices for me. So AI for user experience. So what direction is this train going, this bus going? Left or right? Left or right? Another free trip to Houston available? Nah. So we'll never know, right? But some people might say it's going to the left based on what he's looking for. Somebody might say it's going to a right, but in general, we don't know. So I bring this up when it comes to the experience that we're giving our customers, patients, everyone, and even the users that go to our online websites, right? So I have Dallas Medical Center. I took a screenshot of this homepage, and I told myself, you know, what if we made this website a little bit better? What can we do to engage people that are on the website? I put it in the AI tool and it gave us specific tips on how we want to have better call to actions, you want to have better colors, you want to have better engagement, and you want to move a lot of the most important content up to the top before people start scrolling. So again, useful content that you can do with any type of facility that you have. So why do you think people resist change? Any idea? Why do you think people resist change? Scary? Yeah, we've always done it this way, right? So it could be uncertainty. They just don't know what's going to happen. So if somebody says, okay, things are going to change, they don't know what that means. It could be a change in their career. It could be a change in their location that they have to work at. Do they have a job, right? So you want to explain the change. And even AI is a big change. So if you say, well, we're going to start using this product or service right now, then that's a huge change. So you want to make sure that you're explaining what the change means. Right, so not only that, but thinking about concerns about competence. So when it comes to AI, people might be excited about it, but they might reject it just because they don't know how to use it. So that's when you want to do training and development for your team as far as introducing new software, new AI tools, and then showing them how to use it effectively. Right? And some people feel like it's more work. So sometimes it is more work, but eventually it turns into less work if the tool is effective. All right, so lastly, let's talk about tracking and predicting. So remember, that's another key word that we're talking about, tracking and predicting. So tracking and predicting. So this is analytics. So Google Analytics is a free tool, and what it does is internal traffic, so intranet. If you want to figure out, well, what are your employees looking at as far as the pages? So we had one client, we did training on just overall analytics in this tool, and they wanted to figure out, well, what do our employees engage with the most? So after using this tool in researching, we found that many of the employees engage the most with anniversary posts. So 10 years anniversary at the company, 20-year anniversary at the company. And so what that tells this team is that they can post more content in the intranet for that. So this is for intranet and also external website as well. So it tells you active users at the moment. And the good thing about it is AI is there, so it helps you predict how many visitors you are going to have in the future. Next 30 days, how many visitors you're going to have, and not only just any visitors on your site, but what are they going to be doing on your site? Are they going to be submitting a form, or are they going to be giving calls? Based on the past data, it's going to show you what's been going on. So it also shows you, well, what type of phone they're using, what type of device they're using. It could be Chromebook, iPad, what kind of browser, what type of computer, so iPhone, Safari. So not only does it show you what type of phone they're using, but it tells you if they're standing up or sitting down while they're on their website. Just kidding, I didn't say that. So it's AI, you never know, right? So you never know. So risk of AI. So when it comes to the risk, you got to have human oversight, or else AI is going to take over, right? That's kidding. But biases. So we don't know who is creating these tools. We don't even know what country they're in, right? So when they're creating these AI tools, they might not have everyone in mind. They might just have a certain group of people in mind. Maybe the people that they're familiar with, or the people that they work with, right? The people that they have experience in their specific country. Transparency with the public. So if we're using these tools that affect the patients that we're seeing, then we want to be upfront about how we're using the technology. And we see this in a lot of industries that use like cameras in transportation and buses, right? You want to make sure that people are aware of how it's being used. And could increase the disconnect between clinicians. So we want to make sure that we still have that personal touch and we're still connecting. We don't want to have technology take over that experience that people get when they're using our facilities. So let's watch this video on some of the other risks.
Grandpa, I'm fine. This is just AI. You don't need to wire money to anyone. I am not in love with you. And I do not need your money for a plane ticket. I am AI.
This fake moon landing footage isn't classified. It's AI.
You're probably wondering how I got rich with crypto. The truth is, I didn't get rich off crypto. I don't even exist.
You might be able to tell this is fake now, but it's gonna keep getting better.
We're all AI. There could be aliens, but I'm not one of them. I'm AI.
An herbal supplement did not cure my cancer. I'm not even real.
Uncle Fred, the government has not been taken over by lizard people.
You don't need to send us $5,000 in gift cards because you missed jury duty.
Grandma, it's not real. It's AI.
It's AI.
It's AI.
Bro, it's AI.
Fake faces.
Real consequences.
Think before you trust.
All right, I'm not real, it's AI. Nah, just kidding. So in general, so you want to be careful. Some people watch this video and say, well, what do I do now? How do I know what's real or fake? The idea is you want to be careful of the scams, right? The scams that are out there. Some people say that they have safe words when it comes to their family, right? So even the voice tool I said earlier, scammers are talking like your relatives, like your daughter, your wife or husband. They say, hey, I need some money real quick and I'm in a bind, right? So again, nothing wrong with just hanging up the phone and calling that person, right? So make sure you're aware of all the scams that are possibly happening when it comes to AI. All right, so future growth. So generative AI, more advanced, able to plan and complete complex tasks. So that's what the community is waiting for right now. So right now we're telling it what to do, and we have to do step by step exactly what we need, but eventually it's gonna get to the point where it can use more complex tasks. And faster drug discovery, personalized treatments, and more regulation, ethics and regulation in bias and fair use as well. So remember that 20% of what we do generates 80% of the value, and 80% of what we do only generates 20% of the value. So we want to use AI to help us figure out how can we focus on that 20% that generates most of the value for us. And overall, don't overthink this. All right, so my name is Chris, and what we do is we do AI consulting and we do training on these tools and these topics. And if you scan this, I'll give you the list of the tools that we discussed today. So I know it's a lot, all right, so I'm gonna send you the email so you can scan it as well. And here's my email address, and let's connect on LinkedIn and Instagram as well. Chris N. West on Instagram and Chris Cheetham-West on LinkedIn. So any questions right now before I close out? All right, thanks. And I'll be here for questions, right? So I'll be standing right here. I might go back over there for questions, but yeah, I'll be here for questions too. And I have a panel that we're doing at 1 o'clock.